Good evening, and thank you for joining us for tonight's program. I'd like to introduce myself. I'm Heather Jenkwin, and I'm the coordinator for the Millburn Municipal Alliance Committee, or MMAC. For those of you who may not be familiar with MMAC, we are a group of statewide alliances. Each municipality in the state has its own alliance, and we're funded in part by the Governor's Council on Alcohol and Drug Abuse and the Millburn Township. You may know some of the programs that we do in the community. In elementary school, we help fund Red Ribbon Week in the fall. We work on Family Meal Week in the spring. We fund the peer leader program in the middle school and the high school, and we bring speakers in on different topics related to drugs, alcohol, bullying, character development, and mental health. So we're very pleased to have you join us tonight. We hope you will continue to support MMAC. This parenting program is part of our mission, which we believe to be a holistic mission, where we believe prevention begins with mental health as part of it. So we want to make sure that our communities are healthy, that our children are healthy, and hopefully you will get a lot out of this program this evening. I'd like to introduce our guest speaker, Dr. Sonali Mahajan. She was born in India and immigrated to the United States at a young age. She grew up in Tennessee and completed her general psychiatry residency and fellowship in child and adolescent psychiatry at Emory University in Atlanta. Since that time, she's worked in different states and held a variety of positions, including positions in academics, public mental health, family court, and both for-profit and nonprofit institutions. She brings a wealth of training and clinical experience to her work. She and her family moved to New Jersey less than a year ago, and alongside some part-time work, she started a private practice here in Millburn in April of this year. Her main focus in her practice is to provide high-quality evaluations and ongoing care to children, adolescents, and their families. During her free time, she enjoys traveling, maybe not during the pandemic, and spending time outside with her family, cooking and gardening. So please let me welcome Dr. Mahajan. Thank you so much for joining us tonight.
Thank you, Heather, for that warm welcome, and definitely thanks to MMAC for giving me this opportunity. I want to welcome everyone to this parenting webinar. I hope you all are well and safe and doing the best that you can during this time. I'm glad you're here because I think that with all that is going on in our world, our children may need our help. And I think we need to take every opportunity that we can to help them endure these times and to get them the support they need if they're struggling. Just to give you an idea of how things are in the mental health world, many psychiatrists have suggested that we're heading towards a national mental health crisis due to this pandemic. Even before the pandemic hit, there weren't enough providers to meet the needs of our population. And moving forward, our mental health system is going to get even more strained. As you all know, people are experiencing loss, witnessing trauma, and being isolated due to being on lockdown or quarantined. What that means is that we'll see an increase in panic and anxiety, grief, anger, depression, and post-traumatic stress disorder. So it's really important for us to be able to recognize when our children's emotions and behaviors become a problem so that we can tackle the problems earlier. There's hope in all of this because the sooner we act, the better the chances are for a good outcome. And we all want that for our children, especially if they're struggling. So let's get started. And today we have several objectives for this conversation. First, we'll learn the differences between normal and dysfunctional emotions and behaviors. We'll focus in mostly on anxiety and depression because these are the things that might go unnoticed, unlike other issues that our children may have, like ADHD, for example. We'll also talk about the impact of COVID-19 on our children and on us, and we'll help you identify when you might need to take your child to seek a further evaluation. We'll also look at evaluation and treatment options, and I'll give you some resources at the end. As we get started, please know that I've packed a lot of information into this hour that we have together, And a talk like this could easily take half a day or more. Heather's going to help us mediate any questions that may come up, and we've also left time for some questions at the end. We're also trying to record this webinar, so it will be available for you and others at a later date. So let's start with some background information. Depending on the developmental level, some things that we see with our children are totally within the normal range. But if some of those continue when they should have stopped, then there might be a problem. And we'll talk about those more. Another part is that behaviors have meaning. All the behaviors that we consider to be quote unquote bad may not actually be bad behaviors. They could mean more. For example, if a child is having a tantrum, that could mean that the child is anxious about something or angry about something and not just behaving badly. Behavior is also a form of communication. It could be about an unmet need that the child has. Like if you know that when your children are hungry, it ends up leading to more whining or having meltdowns, then that's a communication that they're hungry and maybe they're tired as well. Another thing is that the behaviors that occur today, they may not be there later in the day, they may not be there tomorrow or in a few weeks. And there's many factors involved in what determines behavior, such as reinforcers of the behavior. There's learning that goes on, there's brain development and maturity that helps change our behaviors over time. We also have mood changes that can happen, and these can be very different from what someone's typical or baseline mood is. And those changes can also be very short term or they can become chronic, and that's when we want to take a closer look. So mood and behavior changes can be triggered. Sometimes the triggers can be identified, maybe by the individual themselves or maybe by someone observing the individual. And sometimes there is no trigger. Now keep in mind that if you have a teenager, they might have triggers, but they might not tell you about them because they're embarrassed, they're shameful, they might be angry about something or angry at you, so they're not going to share why they're having a mood change in the moment. We also want to think about hormone changes, any medications that they're on, their sleep habits, diet changes, any major stresses or changes in their lives, and even substance use. Those things can lead to changes in mood and emotions and behaviors. So we need to keep that in mind as we think about these. And in our talk today, we'll first talk about normal types of anxiety and behaviors, and then we'll get into what looks like dysfunctional anxiety and not so normal moods and behaviors. So anxiety itself is where we're going to start, and that's a sense of worrying or nervousness and uncertainty. We all have it to some degree, and some of us might call it stress, and some of us might refer to it as it's just my nerves. When we think about normal types of anxieties, that actually can change based on the stage of development. And if you look at some of those in infants, we know that they get kind of uncomfortable around strangers. Even if you want to pass them off to a family member just for a quick picture or a hug, they're not wanting to do that so easily. In toddlers, they oftentimes are afraid to be alone in their room at nighttime. They might not want to be separated from you. They're scared of monsters and ghosts and things that they've seen. They might also be afraid of doctor's offices because that's where they start to get the shots at a very young age, and they remember that. When we think about school-age children, they're more worried about natural disasters. That's what I hear most commonly in that age range, is storms and the thunderstorm that's coming or the tornado watch or warning that's out there. They might also be worried about injury and death. And when it comes to teenagers and preteens, they have a little more awareness of what's going on in the world. And so they are going to be the ones that are more worried about health issues in general. They're also more focused on their friends and on school. So they're going to worry about their performance in school, whether they're doing well, are they comparing, similarly to where their peers are. And they're going to worry about how peers think of them, how other students and other members of the opposite sex, if that's what they're interested, how they feel about them. So those are the things that are pretty normal types of anxiety. And if you think about anxiety itself, it's helpful in terms of survival. It helps us be alert and responsive to our environment. For example, if we're crossing the street or driving our car, we need to be alert and we need to get anxious when someone gets too close to us or cuts us off. And in this pandemic, for example, we might notice that anxiety goes up a little bit when we're in very close proximity to someone, or to someone that isn't wearing a mask, and we are. So it's actually a protective mechanism. It can also be a strong drive for some people in certain situations. For example, the stress or anxiety that some people feel can push them to work even harder. So it might play a role in someone becoming or feeling more successful at work or at school or things like that. So, and when we look at typical behaviors, so we're going to talk about what are normal behaviors and emotions in our children and teenagers. And the behaviors that are listed here are just general behaviors that you might see, and these aren't considered out of the normal range. If you have older children, you've probably seen many of these behaviors. So I'm not going to read through all of these. It's just for you to take a look at and think about. But I do want us to be aware of something that's called temperament. Now, a child's temperament refers to the internal ways that they work, or their personality traits, and these are things that they were born with. Temperament actually influences, first, whether or not they show these behaviors that I'm showing you on this slide, and secondly, how much of these behaviors they might show. So as we think about it, we need to keep that in mind. So let me give you some examples of temperament. There are some children who are naturally more reactive to external events. So for example, they're going to the circus. They might show much more excitement than another child might. Or if the circus makes them anxious because there's too many things going on and it's too stimulating, then they might have more tantrums. Another example, some children are able to regulate themselves and their attention pretty well. So you might not see them as being the ones that are overly active, or might cause trouble or disruption in the classroom, for example. And some children, they are more comfortable in social situations, and they can adapt to changes in those environments fairly easily, whereas others might have a lot of trouble if they're going into a new environment or a new social situation. And based on these, you could see how temperament can influence a child's behavior. So again, the behaviors that we see here aren't considered as problematic in most situations, and we'll talk about later how if these continue, or if they go on past these relative stages, then they could be seen as problematic. So we're going to talk about the tweens and then the teens next, and these are, again, typical sorts of behaviors and responses. And tweens we think of around the age of 9 to 12 years old, and this is where we know they're going to talk back a little bit more. They're going to be more competitive. They want to spend a little more time with friends. They are starting to be worried about being liked. They don't want to have those hugs and kisses and cuddles that they, that moms used to enjoy and dads used to enjoy when they were younger. And you might see the start of mood swings happen. And this is actually not uncommon because puberty can hit pretty early. In some children, it begins at 9 or 10 years old. So don't be surprised if you start to see changes happening more readily as they reach this age range. And in this age, they're also exploring their identity a little bit. That's the beginning of their exploration. So you might see that they're interested in different things than what they used to be as an earlier child. When it comes to our teens, many of you who have teenagers might see quite a bit of this. They can be argumentative. They're going to try to push the limits on the rules in the house. They're trying to assert their independence, and that actually is a normal stage for them, is to become independent, because as teenagers, how else are they supposed to learn to be independent adults? This is their time to kind of try things out while having the safety net of parents and of teachers and other individuals that care about them and can help them through those situations. You'll also see them spending much more time with friends and more involvement in social media, less involvement with the family, maybe more time spent in their rooms. They also can have an attitude of, I'm already independent and I should be treated as an adult, and they might feel like they, are invincible, or that there's no consequences that will come to them. So it's an important time for them, but also a sort of a risky time as well for us to kind of keep a closer eye on them. They're also exploring their identity, and in terms of identity, we're looking at gender identity. So a lot of them are thinking maybe they feel more comfortable in the opposite gender role or being the opposite gender. They also might be exploring their physical, changing their physical appearance to express their identity in a different way. So you might see very dramatic changes in the way they're dressing or the makeup they wear, or even who they're spending time with. Their hobbies and the clubs that they're involved with may also change as a form of their identity development. So again, all normal sorts of things that we could expect in teenage years. We are going to see mood swings going on, and sometimes those are triggered and sometimes they're not. And there's going to be lots of hormones for both males and females. So we need to keep that in mind as we kind of work through these years. And then we may see some experimentation with substances going on. And this is usually the time that it starts, and it's a time to kind of have some conversations. Maybe even in the tweens is the time, between 9 and 12 is the time to have some conversations about what things might be, when they get to high school, and expectations that you have for them at home. So the next thing we'll talk about are anxiety disorders that we might see. And then after the anxiety disorder section, we'll talk about mood disorders. So when it comes to anxiety, it can get to a point where it's too much. Anxiety disorders are the most common type of psychiatric illness in the United States. And about 30% of adults in America will have experienced an anxiety disorder at some point in their life. That's a large percentage. Most of these disorders begin in childhood, or it could be adolescence or early adulthood. So it's rare to see it show up in much later in life for the first time. And these commonly, the anxiety disorders, they are very frequently found to have depression along with them, ADHD, maybe oppositional behaviors, and sometimes alcohol and drug use as well. So we want to keep an eye out for these things if we find that we have a child with an anxiety disorders. And of course, as I spoke to earlier, during the time of COVID and the protests and things that are going on related to our world today, I think we're going to be expecting a definite increase in anxiety disorders in general. So there are certain types of anxiety disorders, and these are the major ones that we might see. I'm not going to go over all of these in detail just to spare us the time, but I do want to give you a quick overview of them. And these are seen in children and adolescents, so it's something to be aware about. It's not something that you as a parent needs to know exactly what is going on, but at least know that there could be something like this going on and that you might need to get your child seen by a professional. So when it comes to generalized anxiety disorder, that's a disorder that happens when someone is worrying a whole lot and they have trouble controlling the worry. So they're constantly worrying. It's most days of, most of the day long, most days out of the week. And they also have physical symptoms or physical things going on in their body as an expression of the anxiety. So it could be that they're irritable a lot, or they're having sleep problems, or they're tired. Their muscles are tense, or they feel restless most of the day long. So that's what generalized anxiety disorder could look like. Panic disorder, you guys probably have heard of panic attacks or may have had some. And this is where someone feels extreme anxiety, fears that they're going to be out of control or something horrible is going to happen to them or that they might die. And that comes along with physical symptoms, physical things that they feel, such as chest pain, their heart's pounding, they're breathing fast, they feel like their chest is tightening, their stomach might be upset, or they might be feeling dizzy, or like they're going crazy. All of these things happen in a very short period of time. So we're talking 10, 15, 20 minutes. If someone tells you they have a panic attack and it's lasting for hours, that's probably not a panic attack, and it could be something else, or it's several panic attacks in a row. So people with panic disorder, they also fear having panic attacks later on. So they start to avoid places where they think they might have a panic attack or where they might have had one in the past. Separation anxiety is an anxiety disorder. It really very commonly begins in childhood. And it essentially is anxiety related to being away from their primary caregivers. And they're either worried about themselves, or they're worried about their caregivers, or just feel a great deal of discomfort being away from them. And it often looks like school avoidance. If you ever have seen children or heard about children or have children that have stomach aches in the mornings, or they don't want to go to school and they want to lay in bed and it's hard to get them up and get them going, or they just kind of flat out refuse. that could be separation anxiety disorder. That kind of stuff with school avoidance could also be a couple of other things like generalized anxiety, or it could be social anxiety. Now, social anxiety can be really hard for preteens and teens because that's the time that they're developing their identity. They're trying to make sure they're liked by their peers. They're creating friend groups and maybe interested in romantic relationships. And in about 50% of people who have social anxiety, it starts at around 11 years old. So that's even before high school. That's late elementary school, early middle school, right? So we really want to pay attention to that. And about 80% of people who end up having social anxiety, they actually have it before the age of 20. So it's very common to develop even through high school. There's one that I didn't put on here. It's called selective mutism. It's not as common, but it's where a child can speak in one situation. Most likely that's the home environment, but they don't speak in other situations. So they might not speak at the doctor's office. They might not speak at all at school, or they're only willing to write something down. And this can be really hard in terms of a teaching environment and in terms of other environments where they need to interact with other kids and adults, and they're not able to do that because we think it's an anxiety-based disorder. And so they're nervous for whatever reason and have trouble speaking out. You'll have heard of agoraphobia. It's where people are fearful going to places where they might have panic or where they feel trapped or where they might have trouble escaping. And specific phobias, these are probably some of the most common anxiety disorders. And these are things like having fear of heights or fear of getting into an airplane or getting into an elevator or spiders, things like that. And then the disorders that you see over on the right side, the top two are stress disorders based on trauma that someone has experienced. So it's specifically reactions that occur if someone has experienced or witnessed a traumatic event. And then you've probably heard of OCD, or obsessive compulsive disorder. And that's where someone has sort of repeated thoughts that they can't get rid of. And these repeated thoughts are unwanted thoughts. And then they sometimes have to follow those thoughts with a compulsion, which is an action that they have to do. The action being something that they do to kind of get rid of or alleviate the thoughts. For example, hand washing is a common compulsion. It's done sometimes because the obsession or the repetitive thought is that if I don't keep washing my hands, there'll be germs on me and I'll get sick and I might die. It might be a very irrational thought that if I have germs on my hands and I get sick, then the train is gonna hit the car in the next 10 minutes. So it can be irrational, and a lot of people with OCD actually do recognize that it's an irrational thought, but they can't stop themselves from washing their hands 20, 30, 40 times a day to the point that they're red and kind of raw, and really they need treatment for that. So that's what OCD looks like. Now the last category is just when things don't fit into the criteria for one of these other anxiety disorders, then we would call it an other specified or unspecified anxiety disorder. So. Now, these are the signs that we might see in our kids, and they might sound familiar to some of you. Now, how many of us have had nervousness before giving a speech or a presentation? Like, that's me all the way. And maybe you've had stomach upsets or dry mouth or a rapid heartbeat during those moments. And when it comes to anxiety, like many people might experience, children, especially the younger ones, will have the physical symptoms before they're able to describe it as anxiety. So that's what we need to look out for. So if we're having a lot of stomach aches in the mornings and it's only happening Mondays through Fridays, or maybe it's a Tuesday because that's the class that they have the most trouble with, and that's the class that they're going to have a test in, or whatever it might be. That might be a sign of anxiety for that child. It's also possible to have trouble sleeping, and that's not an uncommon thing. Sometimes it's just for one night, like the night before an event that makes us nervous, right? Such as an interview or an exam. But for people with anxiety, that insomnia is night after night. And then what worsens is that they then get worried about not being able to fall asleep the next night or that same night. So then that just kind of compounds the anxiety that they already had that was keeping them up. I remember having had a bad dream just the other night about something, and I woke up feeling nervous about that situation, what I dreamed about. And I'm sure it didn't help that just the night before I had watched a movie that had a little bit of violent content in it. But I've heard this so many times. It's about kids having bad dreams or more fears after watching something scary. So it's definitely something for us to think about in our homes as we monitor what our kids are into. So, that kind of one-time fear the next morning or the next day is not a big deal. It's not a sign of an anxiety disorder, but if that continues and they're not able to go out, they're not able to be in the room by themselves when they really should be, then that could be a sign of a problem. Now, worrying is probably one of the most common complaints that we hear about when we see kids with anxiety, and it's usually about everything. That's when we ask them what it's about everything. And so it's sometimes hard for children and teenagers to pin it down. Some older teens might be able to. They might say that they're worried about their grades, they're worried about their friends, they're worried about their boyfriend, or they're worried about what's going to happen, with that test coming up. So those are common worries that you might hear about, but a lot of times it's just about everything and they just cannot stop the worrying. And then there's some children that need a lot of reassurance, and they might ask a lot of questions about something. Maybe an event is coming up that they're not familiar with. So with that, they're wanting to ask questions because they are trying to get a handle on the situation before they get to it. So be patient with your children in those moments. We also have to look out for these signs, and some kids do have tantrums because they're anxious. Some kids are irritable. Some children can be clingy and clinging to their caregivers, so that might be like separation anxiety or something like that. They might also have the school avoidance that we talked about before. They might avoid leaving the home, avoid going to parties or group gatherings. So that could be something like social anxiety. It could be even generalized anxiety, because they're worried about their academics, so they don't want to go to school and they're worrying all the time about it. And then there's a lot of self-doubt and wondering, are they doing the right thing, needing that reassurance sort of thing. So the thing we need to know is that if we don't treat anxiety, it can lead to further problems. So we might have chronic sleep problems. We might have academic problems then, and school refusal, problems with our friends, maybe substance use disorders come into play. And actually, I have seen a lot of self-harming and suicidal thoughts in children, more so in teenagers, not necessarily children, in teenagers with anxiety disorders. And what they're doing is they're trying to feel better. And that's the way sometimes self-harming, unfortunately, is the thing that they have in their toolkit to feel better. And so that's what we want to target and try to give them other tools to deal with these anxiety sorts of situations. And so the take-home point to think about is anxiety can become dysfunctional or maladaptive if the symptoms don't lessen over time or they start to get worse over time, if they're severe enough to impair the day-to-day functioning of the child. So for example, anxiety leading to school avoidance, and we're missing 2 days out of a week, 3 days out of every week, that's impairing. And thirdly, if they're out of proportion to the situation or developmental level. So if we have a teenager who's unwilling to stay in their bedroom alone at night because they're scared of something in the bedroom, then that's out of character for that developmental age. And so we might need to look at that and be aware of that. Those are signals that they might be anxiety disorders going on. So we'll talk about dysfunctional sorts of moods and emotions next. And I'm calling them dysfunctional because they are mood changes that are not helpful, and they're difficult to have to deal with. And these are things like depression and bipolar disorder and some others. If we look at some statistics, there was a study done in 2017 in the United States, and about 13% or 3 million of adolescents between the ages of 12 and 17 reported depression. And actually 60% of adolescents don't receive any treatment when they have depression. So that's pretty concerning. And when we look at children ages 6 to 12, we think that about 2 to 3% of children have some sort of depression going on. Now with depression, it can lead to suicidal thoughts and suicide. And unfortunately, suicide is the second leading cause of death between ages 10 and 34. And that's really troubling. And depression is actually the leading cause of disability worldwide. So these are staggering statistics. Things might get worse with this pandemic, so I urge you to do your best to identify these things as early as possible. These are the main diagnoses that people might get from a provider if they're found that, you know, there is a mood disorder going on. We've got major depressive disorder where you have to have a low mood and several other things going on over a 2-week period. So we're not enjoying things, our sleep is off, our energy level is low, we're feeling hopeless, we might have unsafe thoughts. Those are the kinds of things that someone with depression is going to experience. Then we have persistent depressive disorder, which is a lot like depression, but it's actually a low mood that happens over a 2-year time frame. So for the majority of that time, they have had to have a low mood. But in kids, they allow it to be just 1 year of a low or an irritable mood, as long as there's some other problems going on as well. So DMDD, disruptive mood dysregulation disorder. It's where someone, a child, it's not diagnosed in anyone over 18. It's where we've got someone with a chronic irritable mood that actually lasts for more than a year. And along with that irritable mood, they have a lot of tantrums that they have. They have to have 3 major tantrums a week over that extended period of time to meet the criteria for this illness. And it has to be present in 2 or more settings. So it can't just be happening at home. It has to be happening at school, at church, at sports activities, at friends' homes, things like that, to show that someone might, you know, have this sort of illness going on. And then we've got bipolar disorder, which many people have heard of, and that's the extreme mood changes that alternate between periods of depression and periods of a very high excited or irritable mood. And along with that excited mood, they don't need to sleep much. Someone could be sleeping 2 or 3 hours at a time and still be very energized the next day. They have a high energy level. They're talking fast. They're thinking fast. They might also get impulsive and do some risk-taking behaviors during that period when they're in that high phase, which we call a manic or hypomanic episode. And they're also overconfident, or they think that they can do things that they normally wouldn't, you know, try or attempt to do. So that's an illness that's a pretty serious illness, and it typically doesn't get diagnosed in younger populations, but it can if there's enough to warrant it. So let's next talk about how these kinds of things will look in your child, because just like children and adolescents don't always follow the rules of our homes, they also don't follow the rules or the criteria of how we diagnose these illnesses. So this is how it's going to look. And these kinds of things can happen at different times in our lives on a temporary basis. But if they're showing it for a longer period of time, if they're age inappropriate, then that's when we need to get concerned. They might have trouble concentrating. We might see their grades falling, and then that leads to maybe school avoidance. They stop caring about their appearance. They're not sleeping and eating very well. It looks like they have bags under their eyes. You might notice that they're losing a lot of weight or gaining weight. They also complain about a lot of the physical symptoms. And you'll see them dropping out of things that they used to enjoy. They're not hanging out with friends. They might be losing relationships. They'll complain about being bored a lot. And they might have more irritability or anger that you'll see as a sign for the way that they're expressing their depression. And activities with friends and the lack of interest or enjoyment in typical things, are the 2 biggest clues for me that tells me that something more is going on with them. So now this slide is actually more warning signs, and these are more concerning because they increase the risk. It could be the risk of harm to themselves, it could be educational consequences, or it could be legal consequences that come. And there's physical and safety concerns, as you see here. So you as parents must take these things seriously and know that some of these behaviors are occurring just because the child wants to feel better. If our teenagers or kids are talking about these things, then they need us to hear them without judgment and without shutting them down. I've heard a lot of teens come to me saying that their parents will say, "Oh, don't talk like that," or "I don't like hearing you talk about dying." And those really aren't helpful. So if you're not sure what to say, then you can just be there and listen. And then in these situations, when you have these sorts of things going on, you want to seek help from a professional. So if we don't treat mood disorders, we're looking at sleep problems, we're looking at academic problems potentially, we're looking at problems with friends and maybe in the workplace and with family. We're also looking at the possibility of substance use, and then obviously self-harming behaviors and suicide. So the take-home point here is similar to the one with anxiety, right? This is not normal mood change if these symptoms don't lessen over time, if they get worse over time, if they're impairing their functioning, and if they're out of proportion or out of the normal range for their developmental level, which we talked about earlier. Now, the things on this slide, I would say these are all sort of impairments in functioning. So these are definitely the more concerning sort of pieces. So this is just a slide on the impact that COVID is having actually on us and our children. So I'm not going to go over this in detail, but know that your children hear and see things, whether it's on social media or the news or from friends, maybe from you, and they're feeling the anxiety and the sadness that's in the air. And if we think about some of these things, I think milestones are a really important one for our teenagers especially. Think about how important your prom or your graduation or maybe your senior trip were to you and how long you've been looking forward to some of those things. And we have to think about how these seniors have lost these things, and these college graduates didn't get to walk across the stage, you know, like we might have. So be mindful of how these things could be affecting you and your children, and keep an eye out for these signs and the signs that we've already talked about. Now, what can we do as parents? There is a lot that we can do. So the first thing I would say is praise and praise and praise. You can do these things now, even if there's not more serious of a condition going on. So these are general tips, and they're even more helpful if we have more things going on in terms of mood or emotional problems with our children and teenagers. So praise them, praise them. Be very specific about what you're talking about. Be verbal about it. Notice all the positives that you're seeing, even if it seems like little things that they've always done. Notice it, because that helps them feel good and that improves their self-esteem. Notice the positives more than the negatives if you can. If they're having mood changes, if they're having anxiety, don't get upset with them for it. Just know and be patient. Know that they're dealing with things. They're trying to work through it. Don't ask them to get over it, because they may not be able to just get over it, especially if this is a longer term, more serious kind of thing. Be supportive, be calm. If there's an argument going on, then make sure all of you are calm, both of you are calm in that moment, and maybe you need to suggest taking a break, or maybe you need to all take deep breaths before you continue talking about it. So these are just some ideas of what you can do at home, and I have another slide about more ideas. So if you have anxiety going on with your child, then give them some reassurance, but not promises, right? Because things can be unpredictable. I mean, you can say things like, well, we'll do our best to take care of that situation by doing these things, or we think things will be okay because we're doing these steps to try to help them be okay. And give accurate information, focus on what you can do, and focus on the positives of the situation. Encourage good sleep habits, exercise, eating habits, outdoor activity, things, if you can, with friends, but within the social distancing and health guidelines that are there. So all of those things are going to go a long way in terms of helping mood and anxiety things in our children. Also encourage them to talk about their emotions and their thoughts, and be present and available. Now, being present can mean a lot, and there are steps to being present. So how about some eye contact? How about just devoting special time for you and your child to be together, just so you can listen? Make sure you're minimizing any distraction. There's no radio, TV on. You put your phone in the other room. You're trying to hear them out. You're trying not to interrupt them. You can encourage them talking with just simple statements like, I see, yeah, and I got you. And then maybe summarize, right, to make sure you heard what they were trying to say, and that make sure you get it. And then allow them to correct you. And if they're coming to you with a problem, don't fix it for them. Maybe they're not looking for that. Maybe they're just looking for you to listen, or maybe they need some help with problem solving. If you look at some of these steps, think about them, use them at home. And then if you think your child needs more help, then start tracking what things you're noticing, so you can take that to someone that can assess it a little bit more. And then talk to the child about it. Talk to your partner, the other parent, about it to see what they're noticing, and think about getting an appointment. So the next step we'll talk about is evaluation and treatment. And just this slide is a very slimmed down version of what could be discussed in this. But in terms of an evaluation, you want to get a medical evaluation, maybe talk with the pediatrician, get a physical exam, get some lab work done, make sure there's no physical things going on. You also may need to have a professional evaluation. So it could be a licensed professional such as a social worker, a psychologist, or a psychiatrist, just to clarify what's going on, see if there's a real diagnosis or anything that actually needs treatment. And then you may need a psychological evaluation if it's really not clear or if there's some cognitive problem going on. And in terms of education, make sure you get the education that you need when you do go and see someone. Make sure you know what they're thinking about with the diagnosis, and if they're asking you to do certain treatments, well, what are the risks of the treatments? What are the benefits of the treatments? And those kinds of things. When it comes to treatment, there's a lot of options. So you could just watch and wait. If it's a very mild sort of anxiety or mild mood change, the clinician might just say, let's just watch this for another 2-3 months and then see if we need to do any kind of treatment, or come back if you feel like it's getting worse or not any better. We also need to treat medical conditions that are going on, such as thyroid problems or anemia, if that's there. We also want to look at some school interventions and changes in the home. You could also look for therapy. And again, therapy could be a talk in and of itself, as well as medications, a talk by themselves. But there are different medications. Usually for anxiety, antidepressants will be sort of the first line option if there's moderate to severe sorts of things going on. And then there's different levels of treatment. I won't go into those in detail, but if something more serious is going on, then they might need more serious treatment, more than just therapy and a psychiatrist. So there are also a couple of other things that are approved in the adult population, and you might have heard of transcranial magnetic stimulation. It's called TMS. It's approved for depression in adults. And then there's ECT, or electroconvulsive therapy, and that's a really effective treatment in adults as well. So those are not used in children and adolescents. So how to find help. This is a really important slide because if your child or adolescent is having serious issues like suicidal thoughts, like self-harming thoughts or behaviors, or aggression, then it might be best to call 911 or take them to the nearest emergency room if you can get them safely in the car, right? And they're going to assess in the emergency room whether your child needs treatment in the hospital setting or not. There's also a phone number that is called New Jersey Perform Care, and they do have other services, and they also have mobile crisis that can come out to your home to help assess things if you're in the middle of a crisis. So if by chance your child does need to be in the hospital, that's the time for you to start calling other providers, because your child is going to need treatment providers for therapy and medications after they finish their stay in the hospital. So please think about that. For situations that are not so acute, these are ways to find providers for yourself, and for your children, but also for yourself if you feel like you need something. Your insurance company might be the best way to go. They usually have phone numbers on your insurance card, or a website that you can go to. You can search for these options, and search in your vicinity, in your location. But you're going to need to call each one that you find and see if they're available to take new patients and if they take your insurance. You also want to ask your pediatrician for options, and you may want to search for providers in your area. The Psychology Today website is really good because it's got different types of providers, and you can search by location. And then there's also New Jersey Mental Health Care, so there's contact information for them there. And that can help with connecting you to resources as well if you don't have luck with the other ones, or if you just want to start there. On the next slide, there are some other sites and resources that might have links to additional information and providers. So the top two are the ones that I recommend most highly. It's the American Academy of Child and Adolescent Psychiatry. They have this sort of set of tip sheets or handouts on certain things that are going on in children and adolescents. And they're called Facts for Families. There's also the Child Mind Institute that has a lot of toolkits and tip sheets and educational information, and then you can look at some of the others with the websites there. So lots of resources out there. You just have to use some of the things that we're trying to provide to you. So we're getting close to the end, and what I'd like you to see here is take a look at these images, and these are images of what we should be helping our children feel. Now, they're not going to feel this way all the time, but we want to see this more often than not. And we can do this by paying close attention to the clues that they're already giving us, by making small changes in what we do at home with them, and by getting them more help if they need it. So That actually is the end of my talk for today. We definitely have time for questions. And I just am leaving you with some contact information for me if you would like to contact me afterwards for any additional questions or things. So thank you.
So thank you so much. This is a great presentation and a lot of information. I know one of the comments in the chat was, with this being at home and the stay-at-home orders and all the changes that families are facing, it's hard to tell what's normal and what's not, what's situational and what might be something that's longer term. Do you have any thoughts on how we get through this kind of transition period?
Yeah, I think that's a great question. I figured someone might be asking that, and I think it's sort of maybe a little bit of a gray area for us because we are trying to figure out, when are things going to go back to normal and will that happen? Right? So when we get things closer to being where they were, it may not be exactly like they were, but when we get things closer to being where they were, we want to see their behaviors and their emotions go back to where they were before the pandemic hit. Now, if by chance they don't, then that's indication of maybe something more. Maybe the pandemic and the protests and things that they're seeing on TV and the racism, all the things that are going on in our world today, maybe that is having a more significant impact. It is hard to tell in the moment. Is my child spending more time in their room? Is it just because they're bored because they can't be out with their friends? Or is it because they're depressed? And I think we have to look for those other signs that I mentioned earlier in the slides to help you know whether there is something more going on. Right? And you want to see a pattern of this, not just 1 or 2 days of seeing these behaviors, because that could just be a hormone change or, a short-term mood swing or a trigger, and then that trigger's gone, so they're back to their normal selves. So I think it's a tough thing, but if you're not sure, the best thing is maybe to talk to your pediatrician first and get their thoughts, because a lot of pediatricians, they do have some training in mental health. All of them are not comfortable with assessing or treating mental health issues, but that's a good place to start. And if if that's not the option that you want to take, then you can certainly have your child evaluated, one time and see if someone thinks that there's more going on. So as a provider, I know there's many times that I have seen someone and I don't see a need for medication. And maybe I see a need for, individual therapy or just a group therapy or something like that, but it may not mean that they have to start medication because it may not be that serious. Or it could be that this is just your teen reacting normally to the circumstances that they're in, or your child reacting normally. So I think that's when you might need a professional. If you're seeing some of these other signs, along with whatever the main concern is, then you might need to seek help and just find out if there's something to be more concerned about. I hope that helps.
Yes, definitely. And here's another question that is definitely something that I've been struggling with too. That, before the stay-at-home situation, and, I think a lot of parents were pretty good about monitoring screen time, monitoring social media and things especially for middle school age kids. And it's gotten harder because now you have to balance between how much time they're spending on screens and on, like, in my case, it's video games that are very interactive, and that's how they're spending time with their friends. But you do notice some behavior changes with all of this time online and on social media, that it does affect their moods. Like, how do you recommend maintaining that balance, and when is it too much?
Sure. I think, there is some evidence out there that with some of these video games that are out there that have the more aggressive, violent scenery and content, that can affect children. And I think younger ages have a little more trouble discerning what's, real from what's not real, and they might take that in a little bit more. And they might not be able to process everything that they're seeing, whether, it's something happening to a body. I don't want to get too graphic, but what they're seeing, they might not developmentally be able to understand that, that's in the video game. But with things that are going on in the real world, we're seeing it in the news too.
Yeah. I think one of the concerns is that the video games are the way they socialize.
Yes, I
Non-violent video
agree.
games, but that's how they're socializing because they're
Yes.
talking to each other through the video game.
Right. And I think that during the time of COVID and while we, we were under stay home orders, I think that it is okay to relax our limits of what we would say. And we want them to maintain those connections, and we know that through gaming and through social media, that's where they stay connected. Because the other option is that I don't want my child sneaking out the back window, to try to get to their friends, because I'm not letting them do this, online or through social media. So I think that it is okay during this time to lay off of them a little bit, if you will. But I think you also need to make sure that other things are getting done. Schoolwork, for example, chores around the house, time with family. It's about a balance of all these things and making sure that there is time for all these other things pretty much every day. It doesn't mean, and maybe it's a, time that you guys need to create, in your family, maybe a schedule or a calendar of these are the days we're going to do this together or that together, or family dinners. As long as there's some like in-person interaction with the family, I think that's great. And I think, now that they're allowing more gatherings, you're going to have to talk to your kids about maybe they do want to go hang out with friends, but look at the distance and let's look at our face masks and, take sanitizer with you, whatever it might be. So I think we're probably going to be seeing more in-person interaction, but I don't think that we can totally say that laying off of interacting on video games is the way to go right now, because they have to stay connected, or we're going to look at more depression if we don't let them stay connected with their peers. I don't have a certain number of hours that I could give you that's appropriate. I wish I could say that, but I don't have that. So I think it depends on how long does it take to get schoolwork done. Did we get our chores done before we got on the games, or when are we going to get that done? When is time for the entire family to put down all the screens and just be together,
Yeah. What about if someone asks if they have a child who normally keeps to himself and maybe is a little more anxious in normal what advice do you have for helping a parent get that child to open up and talk about what they're feeling and what they're seeing?
Sure. And I think some of that might depend on their age and their developmental levels. So I think with a younger age child, if we look at, preschoolers and early school age children, they may not have the vocabulary to express that, right? So what we want to do is you could, actually start by looking, there's things that you can find online. There are emotion charts. And maybe you could look at that and start building the child's vocabulary to talk about those and to say, when you saw this, what did you experience? Or did you hear, what have you heard about that situation? What do you think about it? How do you feel? Those are the kinds of questions you could ask. And I think with if it's an older age child or a teenager, it might mean that, you just spend some time just saying, hey, I just want to be here with you. And maybe it's not forcing them to talk. Maybe it's just, let's just do a game together. And you never know, in those moments when they feel like it's a safe environment and there's no stress, there's no pressure for doing anything, saying anything, that might be the time that they start letting you in a little bit. And they might say, I like that, or, that bothered me when you did that, sort of thing. Or, just finding moments when you can connect with them so the relationship improves, and then there's the opportunity where you can improve that communication. Not to say that this person has a poor relationship. Some children are just anxious, and it does take them time to feel comfortable or feel like they can. Another way to do it is to think about writing things out, right? Some people are going to be much more willing to write out their feelings than they will at expressing themselves. For example, I was treating a child with selective mutism, where they weren't talking, the child was not talking to anyone in an office setting, but would talk freely and do, videos of themselves, YouTube videos and things like that, of them showing someone else how to do things. So, but what we did, we chose to write things down to each other in the moment. And that's how I was able to kind of see what she was thinking and feeling. So that may be a place to start if they're, a younger age, or even if they're older and they're just not ready to be expressing themselves to you.
And another question was, could sudden weight gain for a child be indicative of a psychological disorder?
Um, Sudden weight gain, I would say, is usually not a psychological disorder. So if we've got sudden weight gain, more likely I would be thinking about a medical sort of thing first. Um, you know, and I guess my question back, and it's okay for that person not be able to answer, but the question would be, are we seeing an increase in appetite, or is something else different, physically or in the home environment? Is it just because we're actually not physically as active as we used to be because we're stuck at home and we're not getting all of our energy and our calories out because we're outside? But sudden weight gain is more common to be a medical condition. It could be something like a thyroid problem or something else that is leading to sudden weight gain. So I would go to the pediatrician for that first, and then make sure it's not a medical thing, and then see if they want to have you see another professional.
Sorry, and then one more.
Sure.
So how would you tell if a child was spoiled versus struggling to cope?
That's a tough one because I don't know what spoiled might mean in that situation. I mean, I guess if you think of spoiled, you might think of someone who is having a lot of tantrums. And I think you would have to see, what the triggers
she's
are.
clarifying that get somebody, a child who's demanding to get their way all the time.
Yes. So some of that could be temperament, right? So it might be that this child can't deal with, the small frustrations or small things of not getting their way. It could mean that there are other triggers going on, whether we know them or not, that's leading to these tantrums, not just wanting what they want when they want it, but maybe the child is also hungry at the same time that some of these things happen. But typically, I mean, I think if you were to think about it, more likely it's not just someone who's spoiled. And if someone is spoiled, then something has to change about what the family might be doing to help that person deal with frustration and to not get what they want, because they're going to have to learn to live in the real world where they will not be spoiled by everyone that they face. So I think that's a really good question.
So would that be a good place where family therapy would be something to look into?
Yeah,
try
it's
to
possible
change that dynamic.
Exactly. Yeah, but you would want an evaluation first for the child and to see if there is something more that the child's able to verbalize or that gets identified when they're talking one-on-one. Sometimes it is easier for children and teenagers to talk to someone outside of the family and to share things that they won't be willing to share with parents or with siblings because of fear of how the parent or the sibling might react. And in those settings, it is easier to talk to someone outside of the house. And maybe that evaluator, that clinician could say, yeah, I don't think it's just the child sort of that needs to change. I think I'm seeing something within the whole family that we probably could address with this type of therapy. So, and there's a chance that sometimes it is individual and family therapy that's needed. It sort of depends on the situation.
Okay. Another question. What recommendations would you make to help a child become comfortable and adjust to a new situation, a new place, a new school, and specifically looking at that tween age?
Sure. I mean, I think that's a great question. And, if we think about ourselves at times that we had to make changes, we probably did our best in terms of like looking into things, trying to figure out what the scenario was going to be like, whether it was the neighborhood or the shopping centers that were there, the grocery stores, like trying to know more about it, right? So when we're coming to a new environment, whether it's a new school or a new neighborhood, you want to sort of slowly introduce that idea and the environment to them. So give them plenty of time to go and take drives around, check it out. If it's a new school, you're staying in the same house, same neighborhood, but it's a new school, then can we visit on a weekend or before school starts? Can we figure out who the teacher is and talk with them? Can we figure out who are the main supports going to be, in the school setting if something was to happen, or if I get uncomfortable, who can I go to? sort of thing. So I think it's more of like giving them the tools to know where to get help if they need it in those new settings, but also slowly habituating them to those environments. So exposing them to the environment so they get less and less anxious about that environment. The other thing you could do is also give them sort of physical coping tools or coping skills to help with that anxiety in those moments. So if we've got the first day of school starting, at a new school, sometimes what I would suggest is that something that's very calming to the child, maybe we can take that in our backpack. It could be a squishy toy, it could be a stuffed animal, it could be, their favorite pen, something that's not going to be disruptive, that's not going to be against the school rules, but something, maybe it's a picture of mom and dad or a picture of their dog, something like that that can help them refocus on what's important to them and bring positive thoughts and memories to them, or positive feelings in those moments of anxiety.
Great. A couple people have asked about if a parent feels their child does need to see a therapist and the teenager refuses to go, what would you recommend in that situation?
That is a tough one. Very good question. I think we have that happen more than we would like to see for teenagers. So it can happen, and the best, it might be that the teenager needs to have a say-so in who the therapist might be, right? So maybe you want them to see a male therapist, but you've got a teenage daughter and there's no way she's going to be comfortable talking to a male therapist. Well, you might need to think, can I switch and find a female therapist for her? Can I have, my daughter look at the description on the website that I see for this therapist, and she see if she'd be willing to go and talk to this person, right? It could mean that, you have to, it's a little tough situation, but you might have to say, look, these are the things I'm concerned about. If I don't see them getting better, then we are going to have to go and see someone. And if they really get to a point where you're refusing, then I'm going to have someone maybe come in and see you here. So there are some people that work as in-home counselors, and there are services like that. There's also that mobile crisis number that if there is seriously a major situation, and that team could come out to the house to assess what's going on in the moment. The other idea is that a lot of therapists are actually doing things by telemedicine these days. So if they're willing to do a telemedicine visit and they're in the comfort of their own home, they're in their bed, they're tucked in, whatever they need to help them feel comfortable with this kind of visit, instead of going to a brand new office where they're not comfortable at all. And maybe
I wonder if that, like, face-to-face, talking to someone through a screen is a little more comfortable in those situations for some kids.
Right.
Than the direct face-to-face contact.
Right. That's right. So those were some of the suggestions. And I think sometimes teens actually have to realize it for themselves. And this is the hard part as a parent, is sometimes you kind of, the saying, you have to let them hit rock bottom before they get better, or before they choose to get help. And sometimes that's what has to happen. So they potentially have to do really poorly in school. They have to be using a lot of drugs and alcohol, and they're losing friends because of it. Maybe there's a legal consequence that happens because they got caught drinking and driving. Sometimes those tough situations that have to happen before they will seek help. So that's what I would say, about that. It's unfortunate. We hope they have more insight before that happens, but sometimes it's not there.
Right. And we have one last question, and it has to do with sleep schedules. Middle school kids, and I've seen this firsthand, staying up during the pandemic, their sleep schedules are off.
Yes.
Or different. Staying up very late, is it because they're not tired, because they're not doing as much as they would normally be doing if they were in school? Is this their normal? We've heard studies about later start times for high school kids, that developmentally it's better for them to stay up late and sleep late. What do you know about that?
Yeah, I think middle schoolers are closer in their development to high schoolers, and I think that we could be seeing that it's just natural for them to stay up late, and that's just where the way their body works, right? And now it's almost like they're a little bit on vacation, not so much, but this is what happens on weekends during the school year, is that they stay up late and they wake up late. But it's a
What about
little
for
tough.
younger kids too? The younger kids in the same house that may be staying up late as well.
Yeah, you just, you want to be careful as a parent. So how late is is okay, kind of depends on what is their functioning like the next day, right? Are they able to get through their schoolwork? Are they falling asleep on it? Are they cranky all day long because they didn't get enough sleep and you had to wake them up because they had to get their schoolwork done, or they had to be at that Google Meet or whatever was going on? So I think their impairment during the day kind of determines how much sleep your child, needs in the evenings at nighttime. And I think it's, you know, kids need a lot of sleep and they're doing so much. And their brain is growing and developing and processing so much at night. And that good, solid amount of several hours of sleep is the most important thing. So even interrupted sleep is not good sleep, right? And we know that. We know that we are not at our full force the next day when we're waking up and falling back asleep multiple times at night. We do that naturally. We don't even realize it, but if we're staying up a lot. So again, staying up late is not healthy in the long run. I think for this time, because we've been on stay home orders, it's okay as long as they're able to get their other chores and things like that done during the day. Now, when school ends, it's a regular summertime, and I'm sure all schedules will be off. But I encourage you all as parents to think about starting your school schedule, your school sleep routine earlier than the first day of school. So start it, 3 weeks in advance and get a little closer to that school schedule as you get closer to the first day of school, so that kids aren't really angry at you that first day. So.
Yeah, we've been seeing that too, where hey, mom and dad are ready to go to bed and the kids are nowhere near ready to go to bed.
Yeah.
That's hard.
Right.
Well, thank you all so much for these great questions. I learned a lot. I hope everybody else did too. Thank you, Dr. Mahajan, for your time.
Sure.
And we will have a link to the video, and we can share that out if anyone's interested. I have everybody's email address. I can send the link out to everybody who participated. And hopefully we'll do another one of these very soon.
Yes, thank you so much. I really appreciate your questions and this opportunity.
Yeah, everybody stay safe.
Thanks. Bye.